what is the early childhood system in general? So you all have seen this graphic a lot before, but we're working to create this coordinated and aligned early childhood system. And when I present this particular slide to the mayors and city council people, I show them that this is what we talk about when we think of the ideal early childhood system. So comprehensive health services that meet children's vision, hearing, nutritional, behavioral, and oral health, as well as medical needs. Then in early learning and development, you have early care and educational opportunities in nurturing environments, whether that's in childcare or in the home, where children can learn what they need to succeed in school and life. You've got family and leadership support, economic and parenting support to ensure children have nurturing and stable relationships with caring adults. And then kind of intersecting all of that as early interventions. So children being identified early and assessed, and then appropriate services for those children with special healthcare needs, disabilities, and developmental delays, they get those services. And so as Early Matters, we are working to kind of coordinate all of these and hopefully create some alignment and easy transitions between those particular sectors. And I love this quote. We're recording this part so that we can share it out for people who onboard later to Early Matters. But this is a quote that we included in the Early Care and Action Plan that we published in 2022. And I think that it really kind of underscores why it's important for the sectors to come together. Does anyone want to read this? Or I'll just be quiet while you read it. Children are rarely behind on only one dimension, which I thought was pretty important, and that the best thing we can do is to have an aligned, coordinated response for those children, and that produces the best results. So I am not going to talk the whole time. Actually, today I'm going to turn it over to some of our partners in the room to discuss for us why each of the sectors matters and who is included. So first up is Betsy Morton with Nurse Family Partnership.
Hi, y'all. I was so excited when Jennifer approached me and said, hey, would you talk about health? Because we're all about health at Nurse Family Partnership, especially we focus on the first 1,000 days, so pregnancy through baby's second birthday as the optimal time for infant brain growth. And as we know, and you guys all know, 90% of a child's brain is fully or at least developmentally in place by age 5, which is before they even start school. So the earlier we can focus on this, and this is why Erlanger Nurse Family Partnership focuses on prenatal through age 2, but we are talking about through age 5 because we know that the impact of those early childhood experiences is so important. The effect of the experiences that a child has from birth through age 5 in terms of their physical, emotional, behavioral, cognitive, and language development are very much affected by the interactions that they have with their primary caregivers and their early childhood experiences. So attuned parenting is one of the big focuses of our program. We talk about attachment as crucial for that baby's brain to form properly, that they have an attuned parent who is meeting their needs, is enriching their environment, reading to them, playing with them, singing to them. All of these things help that baby's brain to develop optimally, which leads to language acquisition, earlier language acquisition, and school readiness. So we're talking about children who are behind. Things like adverse childhood experiences really affect a baby's brain development. So parents with mental health challenges, substance use in the home, or violence in the home are all things we know that hurt a baby's brain development and formation in those early years. It actually goes down to the DNA level. I was like, I wanted to tell Jennifer, we should include this, but if you want more information about how negative and toxic stress, high cortisol levels in parents affects the DNA of their developing child, it's fascinating. The reason why there are health disparities, one of the reasons is that it affects the DNA on a very small micro level, but that's health. It affects the health of our babies, of our families. So the other thing that we talked about is that a lot of times the players in the healthcare field are siloed. So we have OB providers, we have pediatric providers, we have early intervention, we have nutritional support. But all of these are sort of separate: dental, vision, hearing, OT, PT services. All of these things can support families, but a lot of times they're not talking to each other. So one thing that I love about what Jamie is doing at Parents as Teachers and what we are doing is working with parents in the home to connect what we're seeing back to providers and connecting clients to resources. So if we see flags for developmental issues, maybe slower development than we expect, Tennessee early intervention referrals can happen. We can contact the pediatrician if we have concerns, or even the OB provider, and talk about what we're seeing so we can get support and interventions early, and to get clients connected to those resources that they need. We feel like supporting health is the foundation for all the work that you guys are doing, because again, if a child has a toothache or is not feeling well, they're not going to be able to learn in school or even in the childcare environment. So all the things that we're doing are working together, but we want to support that family in a holistic way to make sure that they're healthy in every way. One other thing that we've talked about at Early Matters, I know you guys have talked about, is that sleep is a really big problem, especially for children living in poverty. The recommendations for the under 5 years of age group is that they should have 11 to 14 hours of sleep per day. And sadly, we noticed that sleep increases as household income increases. So if moms have to be up at 6 o'clock at work, then the babies are getting up way earlier than they should to get to childcare. If they've got a long commute, and again, it's going to cut in on the baby's ability to get the rest that they need to grow properly, and that brain development happens while babies are sleeping as much as when they're awake and having enriching experiences. So another really interesting statistic: 10% of respondents listed cost as a barrier to accessing healthcare, and 27% of respondents were unaware of parenting support or postpartum support for their included in maybe their TennCare. One really bright note that I will mention is that Tennessee passed a law that when a mom has a baby, she gets TennCare for that first postpartum year, which is crucial because maternal mortality in the year postpartum is a place where we see a pretty high maternal mortality rate. So having access to healthcare and mental health and other services is crucial. So thank you for that.
Hi, Heather Hicks again from the CCR&R, and I'm going to focus on early learning across the state and what we know, and I focus on early learning across state. We're going to focus on Hamilton County. I have to switch that hat real quick. So we want to talk about why it matters, and Betsy set the stage for that, right? Why does it matter? Because we know of the brain growth that's happening in those first 5 years. How are we going to nurture that? How are we going to make sure that it's happening? And one way that it happens is through childcare, right? So that children are in an environment where their foundation in their early learning is being built. that they're being poured into. They have attachment with caregivers who are consistent. Not lately, but that's our goal. But all these things are important, and early care and learning and childcare really plays into that and really helps reduce some of those risk factors that occur when children are high stress, the cortisone levels high, and all those other pieces. We want to make sure they're in a safe, healthy environment to help do that piece. So it really does matter that we're making sure that there is adequate and not just adequate, but that it's available and open to everyone. Okay, so, and when we're talking about the early learning sector, we're talking about everyone. And what everyone means is the families, it's the caregiver, it's licensed childcare, it's voluntary pre-K, it's family, friend, and neighbor care, it is family child care, it's all of these pieces that come together. It's the resources that we can provide through the Child Care Resource and Referral Network, through Chat State, through UTC, through the different programs to do that. The City of Chattanooga Office of Early Learning, and the museums, the libraries, everywhere that we can have a touch point with children. When we're talking about early care and learning, we're talking about this group, not just a child care center. We're talking about the whole community, basically. One of the things that I think it's important to know about the access for early care and learning, right now we have 151 licensed, DHS licensed, Department of Human Service licensed child care agencies in Hamilton County. All of those agencies have a capacity for 11,609 children. Katie was able to make phone calls over the summer, and so my touch point is going to be her July data that she was able to get. 58% had their seats. 58% of the seats were filled, right? So 58% of the possible 11,000 mean that only 6,700 children in Hamilton County were in licensed childcare. So that leaves about 4,800 seats open, and they're open because the workforce is a struggle right now. So without the workforce, in order to be in the classroom to work with the children, the seats can't be filled. Voluntary pre-K has 800 to 900 seats, but I'm not sure I don't think they were all filled, right? I'm not sure where that number lands. So what I'm trying to say, and the point I want to get across, why this is really important, is because we have seats, we don't have a workforce that can do that. And we need to look at that piece, and we need to see what we can do as part of our group to really get the importance of childcare out there, professionalized childcare. I will tell you that we have 16 childcare agencies in pre-licensure. That means that they are on the way to becoming licensed in Hamilton County. We won't know how many seats they have until they get their official license, but we are increasing a little bit. So hopefully those agencies that closed during COVID, hopefully this is going to help raise the level and ease some of that gap. It is a 2-generation approach. It actually goes back, when you talk about epigenetics, 7 generations, the effect that's happening with stress. But we really want to make sure that our children under 6 are in those healthy and safe environments, that we're able to give them the skills that they need, that they're having the experiences to cut paper, to walk, to talk, to small motor, large motor, problem solve, that they're having everything they need to help set the stage to be ready for kindergarten, that they have the tools that they need. And we know that high school graduation in the future workforce are those kids. All of this is affected. The rate of high school graduation, what does our workforce look like, right? I often say, you know what, these kids are going to be putting counting my meds out, right? They might be landing my plane. They might be doing my electrical work. I'd like my house to not burn down. They might be doing my plumbing. Let's not flood the place. If we're not here to give them what they need, right? What's going to happen? That's a little doomy gloomy, but I think about that. Like, so how are we pouring in? What books are we reading? Are we talking to them? What are we doing? And working family is very important. I'm going to show you some stats that we have that show just how much the workforce, how much money was lost because people were unable to get to work and do their job. We also know that if you have a better balance at your work and home responsibilities, you're able to better parent, you're under less stress. So the likelihood of child abuse and neglect is reduced. You've got optimal child development and healthier families. And with less anxiety, and when you're anxious, your children can become anxious. They become a little bit harder to parent, and then you're stressed and things can happen. So all of this matters. It's all very interwoven and connected. And so how are we going to do it? We need to get some talent in the pipeline. We do have some programs working, and then we have to really change the message of early care and learning, because they're not babysitters, they're professionals. They are building the brain of foundation. They're building that 90%. So here's some of the stats that local data that came out of the survey, and $94.4 million was lost when parents weren't able to work. That's a lot of money out of the economy. What I found very interesting was what the top 4 areas that parents were most interested in. It's the number 2 bullet, the bottom square, in defining what did quality care mean to them, that it was a safe and healthy environment, that they had a caregiver who was nurturing and affectionate, who loved their child as much as they did, that they would communicate. There wasn't just a drop off and pick up, but there was actual communication about what was happening in the classroom with their child, what's the development look like, and that the playground and other areas were safe, and that they had additional space so that children can move around that. We've all heard the stats about the cost of care. Infant care is about $11,000 a year. It's expensive to take care of infants. Your ratio is smaller. You need more people to care for infants. So it does cost more, but we also know that it's a lot of a family income to pay for that. So how are we going to help alleviate some of that stress? I asked a lot of questions without giving you, I feel like all I was saying is, how are we going to do it? What are we going to do? But it's a lot for us to think about. It's a big elephant, but I think we can do it. Don't you? I'm kind of excited about it. Yay. So anyway, there's just so much in all of this, from the health, the workforce, and then we're going to hear about family and family support. It all just weaves together. We can't do one piece without the other. It's a tapestry, actually, and we're all putting our piece to the picture. Oop.
Yeah. No, I'm not doing it.
So I'm sorry. So family supports, why does this matter? As we've seen so far, that our families have a lot of things that they have to navigate. And we know that when we're working with our parents, we know that they're the first and best teachers. We always want to empower them, encourage them with that, because there are so many systems out there that it can easily become where a parent can rely on the services, or they kind of get opposed to the services because they feel like there's an encroachment. And so because we see that parents have that first role, they're the first doctor, they're the first encourager, they're the first educator. We really want to support that, but we also want to come alongside them and provide some assistance as well, because we know that not all of our families are approaching life with the same equal access. So we really do want to make sure that our young children have an opportunity to thrive, and they thrive by access to resources. And so when we look at the data within our local community, when I first pulled this up, I was like really encouraged by this number. When I looked at the majority of families who that were surveyed, they see education as important. And this isn't just focusing on formalized education K-12, looking at education, learning how to best provide nutrition to your family, mental health, how to take care of your family needs, how to instill play in children, how to build up that kindergarten readiness, that the majority of families within our community see the importance of education. But now look at that other number, this 44%. When we look at almost half of the families surveyed living in our community, 0 through 5 are living in homes where there's a financial struggle. When there's a financial struggle, as Heather had touched on before, it is not just being able to provide resources to the little ones in your home. It's not just being able to overcome that food insecurity or where are we going to live or that type of thing, but it's access to childcare, it's access to other resources, access to clothing. And it's also just the comfortability of your mind where you can go to bed at night feeling like I can take care of this kid. And so when we look at that need that we have here and we look at some of the open opportunities within our community, we start to, I look at the little ones who are coming into kindergarten and what foundation have they had as they're coming in. We look at the openness of our childcare seats, like how, when we compare the number of children under 5 in our community, even if you look at that 21,000 and you look at, wow, that means there's like, according to the survey, there's about 10,000 plus kids within our community who are not going to get the same opportunity that some of our children may get. And so this is why supports matter. And so just within this room, there is a great variety of family supports. And it is important that we have this type of interconnectedness so we can work together. I love Jennifer's model of the multicolored spaghetti, because often that is what it's like for a family. They approach a system and it's like multicolored spaghetti, which is, I am actually going to hand out some flyers when I'm done about our Family Connection Center, because we are one of the community providers within Hamilton County. And so what we noticed was a lot of our families saw Hamilton County schools like multicolored spaghetti. I've got my social worker, I'm a new enrollee, I speak a different language, my child has exceptional needs, I have a bus situation, I want to apply to a magnet school, my kid had some learning loss, we want to get them in summer reach, I don't know how to get on Power School, I'm not sure how to get my child ready for kindergarten, and it goes and goes. And so what we start to notice is that it's beyond that. And so our families are coming into our system, and yes, they want their child to be in school, but now they've got all these other little bullet points around the wheel that they don't know quite how to navigate. And so we have actually opened our Family Connection Center. We within Hamilton County Schools. We don't have the best location over at Central Office, but we are supporting our families also through phone and virtual support. And so what our office is designed to do is help families navigate that multicolored spaghetti. We want to be a basis of support for our new families coming into the district or our current families that have just been not sure what to do. And so we're there to support them in a variety of ways, whether that is helping them with community resources or getting connected with their school social worker, helping with the registration process, other different supports. And I can honestly say the feedback that we're getting from families is something that I think families have been looking for, but I think is what the district has been looking for. If we're one of the largest service providers within Hamilton County Schools, we want to make sure that we're servicing our families and not having them feel like they're on an island. We want to be on that island with them and pull them in to be part of a connected system of supports. So I'm going to start sending some of these around, but I do want to highlight the different service providers we have, because a lot of you are part of the piece of that puzzle. Our public library matters. It offers so many opportunities for our families. I love the opportunities that are there, the early learning opportunities, the welcomeness of the environment. You look at our foster care services, you look at children's services, you look at medical, even for our families that may be homebound or have different issues. The fact that we have opportunities within our community that provide visitation for families that can help our families get supported. I won't list all of our different community partners, but as I was preparing for this, I started writing down a list. And if I am a new family coming into Hamilton County and I have a place to point me to these places, I know we've been doing some asset mapping, a family could really feel very encouraged and supported. Now, imagine a family with a little one, or maybe 2 or 3 little ones, and they're navigating the system. What we're providing with Early Matters in terms of having our families have this this opportunity for access and high quality resources, we're really helping them not feel alone as they're trying to be the best parents that they can be and being the first parents for their kids. So I really love the resources that we provide here in our county. And now we're going to look at early intervention.
Everyone, I've had I'm a psychologist by training, and I directly support our preschool assessment center, the PAL Center, which is here on the second floor, just to our left from where I'm standing, as well as private homeschool services. And that is a component of Hamilton County Schools that is also based here at West Florida. So I'm excited to tell you more about early intervention in Chattanooga and Hamilton County, and wanted to just reiterate a few of the points that were shared leading up to this point, because it really focuses on what Jennifer was sharing about the early intervention piece, tying into all of the other 3 areas. So we think about Betsy sharing with us that 90% of brain development occurs by age 5. And then we think about Heather sharing that early learning care encompasses all of us. And then moving on to Angela sharing that parents or other family members are the best and first teachers that children have. So let's think about why then early intervention is so important. Think about those 3 things that we just revisited. First point that I want to share is that early intervention services can change a child's developmental path and improve outcomes for children, families, and communities. So thinking about that component of brain development, the earlier we can identify needs that children have and provide intervention services and supports, the better we are in hopefully setting a trajectory of continued growth for that child. Families benefit from early intervention by being able to better meet their children's needs from an early age, and hopefully that then empowers them to continue providing that need and care for their children throughout their lives. We often experience families that come into our PAL Center that feel as though they're not equipped. I'm not quite sure, what to do. Am I helping my child the best way that I possibly can? We always want to reinforce for them, you are doing exactly what's needed by coming and accessing this resource. So the really important key is making sure that within the community, we have the supports in place so that families know what resources are available to them, including those related to the early intervention piece. So some early intervention providers. I'm going to take a moment to give some additional information about some of what's listed here. So Tennessee Early Intervention Services, that is a service that, and Betsy mentioned it as a part of her component with health, that is something that is available to families starting at birth and through 2 years of age. I say that, though some of you have been in meetings with us where we've talked about Tennessee Early Intervention having an extended option, that last year was extending services to the child's 4th birthday, and now extended this year to their 5th birthday, so leading up to kindergarten. That is a service that is related to, if anyone's familiar with the Individuals with Disabilities Act, IDEA. IDEA sets forth provisions for that early intervention piece starting at birth and up to the age of 3. That's referred to as Part C of the IDEA, the federal law. And then we shift to that second bullet in terms of at the point of a child preparing to turn 3, the federal law requires that the local education agency transitions children to determine if they continue to be eligible for services at the age of 3 and beyond. So what's critically important, and what I'm so proud of in terms of the work that we do with Hamilton County on behalf of the community, is that here at PALS, this is the center where those transitional evaluations occur. So prior to that 3rd birthday, if a family can opt out, but most are at least interested in accessing the transitional conference to talk about transitional evaluations. What is interesting is that with the extended option, whether a family is interested in knowing if their child might be eligible for services with Hamilton County Schools, or they're thinking, I really like what's happening with TIS and I want to stay in this extended option model, we still have to evaluate, we being Hamilton County Schools have to evaluate in preparation for that 3rd birthday. That is the only way that a family can then access the extended option. So again, really critically important work that's happening between Tennessee Early Intervention and Hamilton County Schools here at our PALS Center. So once, if a child, and so that, sorry, I'm giving you all some technical information, but just to show you that there is this law that supports this provision and this opportunity for families and children. So the starting at the age of 3, that is considered school age services. So from the age of 3 through the age of 21, up to a child, not at that point, not a child, but a young adult, through the age of 21. So their 22nd birthday can receive services under what is referred to as Part B of the federal law. Within Hamilton County Schools, we offer services through what's called an individualized education plan. And those services, here I mentioned the developmental learning programs. We have learning programs that are scattered throughout the district where children may need more comprehensive needs. So a more traditional type school setting that is supplemented with related services such as OT, PT, speech language, vision, hearing services. But we also have children that may not necessarily have needs that rise to that level of support. And so we also offer around the district what we refer to as walk-in services for speech language services, if that's the area of need for the child. Whether we're talking about birth through the age of 5, right before children are getting ready to start kindergarten, we've got a number of private agencies and service providers that certainly touch the lives of children and collaborate with TIS and Hamilton County Schools. So some of those, and this is not all inclusive, but you'll see Signal Centers, Siskins, Speech Hearing Center, Pediatrics Plus, Associates in Pediatric Therapies, Children's Therapies at Erlanger. And then if you're not familiar, we're getting quite a lot of children that are benefiting from applied behavior analysis clinic support. And so the Chattanooga Autism Center and Elevate are just 2 of those service providers that are helping with that behavior component. All right. Now, what I'm sharing here in terms of some local data points if you notice, you'll see that this is data from 21-22, and that is because that's what was available to me with regard to the Part C services, and so I just wanted it to be comparable in terms of the other components of the data. So with IDA Part C, we had 692 children that were enrolled. Now, please, I do want to point out that this is in the Southeast region. That's how it's reported at the state level. And so that includes Bledsoe, Bradley, Grundy, Hamilton, McMinn, Marion, Meigs, Polk, Ray, and Sequatchie counties. So do keep that in mind when we're looking at that 692. And so that is birth through the age of 2, right before their 3rd birthday. And then in that same year, we had 439 children that were eligible ages 3 to 5 years old. And the 5-year-olds did not include kindergartners. So those were 5-year-olds at the pre-K level. And then here at our PAL Center, from July 1st of 2021 to June 30th of 2022, we had 639 children that were referred for evaluations with us. So we are honored to touch the lives of quite a lot of young children and their families, and the needs just keep growing. Again, can't speak for the Part C, but Part B and our referrals have gone up in the last 2 years from this data set. Thank you. I don't have the Part C, the Southeast region EIS services. Did not have that available directly to me, but I'm sure it's information that we can, gather for you if that's something that you're. Yes. So we are well on our way this year of exceeding 750 referrals for this year at the PAL. So we do have an increased demand. The district's been wonderful to recognize the need, and we were approved to add a 3rd team. So when I mentioned teams, we currently have 2 comprehensive teams, and the teams include a school psychologist, a speech language pathologist, and an educational diagnostician. We were approved for a 3rd team because of the growing needs. Unfortunately, the Chattanooga community, state of Tennessee, and nationally, we're experiencing a shortage with regard to school psychologists and speech language pathologists. So though those positions were approved and posted back in July, we have yet to fill them. Yeah, and not because of lack. It's due to available candidates applying to the position. So if you happen to know of any school psychologist or speech language pathologist, please send them our way.
Thank you, Kathy.
Thank you.
Thank you, Betsy and Heather and Angela, for presenting. I count my lucky stars every day that we have such experts who choose to come to Early Matters and kind of learn from one another every other month. So I did want to take our puzzle piece here. So we've talked about aspects of what we are doing to support the whole child needs in Hamilton County. And I do want to emphasize that the child is at the center. So at the end, I think we do a lot of talking to elected officials and state officials and businesses, but in the end, we are trying to help children in Hamilton County. Some of the work that we've done over the last year, I'm going to go through this really quickly. The biggest challenges that are being faced by each domain, which I have learned quite a few things during these presentations that I'll be adding to the slides, but In early learning, and some of these were challenges that are now being addressed. So we are going to have our first baseline kindergarten readiness measure that's nationally normed starting in August, which we're really excited about. Early childhood educator recruitment and retention. We have a working group who's going to be focused on all of those innovative ways that we can support and bolster the early childhood workforce. Wages, respect and prestige for the profession, which is something that Heather mentioned. And then just, there aren't a lot of people paying attention to early childhood policy across the state. There's no, if you know of something that I don't, please let me know so I can subscribe to that newsletter. But there just aren't as many early childhood advocacy organizations in Tennessee. From the health standpoint, there's a general lack of kind of community health outcomes when it comes to asthma and childhood obesity, and kind of a convening around that. Pay parity and telehealth reimbursement for mental health and physical health visits, a scarcity in child school psychologists and speech pathologists. And then we have some family leadership and support challenges that we're working through too. And then underlining all of that, we don't have an early childhood data system that kind of gives us insight into all of the supports children are getting from birth to age 5. So until they get to Hamilton County schools, we don't really have visibility into a lot of the children in Hamilton County.